This is a research study that is looking at the health of children who come to Boston Medical Center for their health care. We are hoping to follow 6,000 children from birth to the age of 21. You are being asked to participate because you are between the ages of 12 and 17 years old and you receive your health care at Boston Medical Center. In future years, we may also ask to talk to you about other studies and ask you to consent for additional testing. We will not perform any additional testing without talking to you about it in detail first and getting your consent. We are asking you to participate in a research study about health of children who get their medical care at Boston Medical Center. We are interested in learning about what illnesses children get, including developing food allergies, asthma, how children grow and develop, and what health problems children who come to Boston Medical Center have. We want to follow a total of 6,000 children who, like you, come to Boston Medical Center for their health care. The research will take place at Boston University Medical Center. As part of this study, we will ask your mother questions about your health, development, and activity, like how much television you watch, what sports you do, if you have been sick, or any stressful events have happened. We will ask you to fill out some questions on your own about your own puberty development. You will fill out the questions about your puberty development on your own, although you can ask your mother to help answer questions if you are unsure. We will give you an envelope to place your answers in so no one will see them after you answer the questions. We will also get your health information from the medical record that is kept on you at Boston Medical Center. The medical information we will collect will also include the results of any blood tests, x-rays, or other medical procedures you have had done. We will review your medical information on a yearly basis. We will also draw between 6 to 12 milliliters of your blood, approximately 1¼ to 2½ teaspoons of your blood to test for genetic biomarkers, including food allergy biomarkers and other genetic biomarkers from your blood sample that may be connected to your growth, health, and development. We will ask you to stand on a scale to measure your body composition unless you have a pacemaker or other internal electrical device. We will not test your body composition if you do. We will ask you to blow into a machine called a spirometer. This machine measures how much air goes in and out of your lungs. This test is done by blowing very hard, like blowing up a balloon or blowing out a lot of candles into the tube connected to the machine called a spirometer. You will place your mouth around the end of the tube and blow as hard as you can while wearing a plastic nose clip on your nose. The nose clip prevents you from letting air out of your nose while blowing very hard into the tube. If you are having any asthma symptoms like wheezing and shortness of breath, we won't ask you to blow into the machine. We will wait until you have another appointment and you don't have any asthma symptoms. Each year, we will measure your waist circumference. We will use the cloth tape measure and measure around your belly to see how many inches it is. We will do this once a year. Each year, we will do a breathing test on you called the forced oscillation breathing. A short teaching session will be done to show you the lung function testing machine. During the test, you will have to sit still for 30 seconds with a tube-shaped mouthpiece in your mouth. You will put the mouthpiece in your mouth completely and close your lips over it while putting your hands on your cheeks to hold them flat. You will have to breathe quietly. Quick puffs of air will come from the machine, and during the test, you will wear a nose clip to stop from breathing through your nose. Since this may be uncomfortable, it will be introduced slowly. Each year, we will ask for a urine sample from you. You will be given a small plastic cup with a plastic lid that twists on and off. and we will ask you to use one of the clinic bathrooms and pee into the cup, then twist the lid securely onto it. If you are unable to urinate during your visit, we will try to get a urine sample the next time you come into clinic. We will test your urine for environmental pollutants and toxic metals only. Your mother will be asked to answer a questionnaire about your development called the Social Communication Questionnaire. If the score for this questionnaire comes back at 11 or higher, and you do not have a diagnosis of autism, we will ask your mother to come in again and complete an evaluation called the Autism Diagnostic Observation Schedule. This is an evaluation that involves finding out more about how you communicate and your social behavior. It will be done here at Boston Medical Center by one of our study developmental and behavioral specialists and takes about 45 to 60 minutes to complete. We also ask your mother to give us permission to ask for your reports from your teachers or other social programs you may attend. We will give the results to your mother and your primary care doctor. If you or your mother do not have time to complete all the procedures or questionnaires today, or you cannot do the procedures, you can still participate in the study, and we will complete these items during another clinic visit when the time permits, or when you are able. You can still participate and choose not to have your blood drawn. For girls who have already gotten their first period, because being pregnant would dramatically change the measurements described above, your mom will be asked if you are or may be pregnant before we do the following procedures: lung function, BIA measurement, puberty questions, waist measurement. We will not do these measurements during a pregnancy. You may feel a small amount of discomfort when you have your blood drawn. You may also get a small bruise at the site where you had your blood drawn. This may last a few days. Infection is very rare, but if you develop any redness around the area, call one of the doctors listed in this consent form. There is also a very small chance of loss of confidentiality of your medical information and a potential risk that your genetic information we analyzed from your blood samples could be used to your disadvantage. For example, if genetic research findings suggest a serious health problem. However, Massachusetts and federal laws generally make it illegal for health insurance companies and employers to discriminate against you. And because this testing is done as research, the genetic measurements are not used to make a diagnosis or any decision about your health. You may feel uncomfortable doing the lung function exam called forced oscillating breathing and be scared by the small puffs of air. The pulmonary function test may make you feel a little lightheaded or dizzy, like when you try too hard to blow up a balloon. This should go away in a couple of minutes, and you can sit down and stay in the research room until you're feeling better. You may feel uncomfortable or embarrassed peeing into a small cup, and you may end up with small amounts of urine on your hands while trying to catch urine into the cup. You may feel embarrassed answering questions about your puberty. No one will look at your answers while you are filling out the form, and we will give you a manila envelope to put your answers in when you are done. Although the ADOS is meant to be a non-stressful evaluation, you may feel a little nervous knowing that you are having an evaluation. The study members will answer your questions and be nearby during the evaluation. You will receive no direct benefit from your participation in this study. You will not receive a copy of any of the genetic analysis done on your blood. However, your participation may help the investigators better understand the health conditions of children, including food allergy and health needs of the children who receive their care at Boston Medical Center. If the ADOS evaluation raises a concern for autism or other developmental problems, your primary care doctor will be notified so you may get the help for the areas they think would be helpful to you. You can also choose not to participate in the study at all, and you could stop participating at any time. There are no costs to you for participating in this research study. You will not be paid to participate in this research study. Your mother will receive a gift card for you for $15 after each completed study visit. Information from this study and from your medical record may be reviewed and photocopied by the Food and Drug Administration and or state and federal regulatory agencies such as the Office of Human Research Protection as applicable, and the Institutional Review Board of Boston University Medical Center. Information from this study, including your allergy blood test and from your medical record, may be used for research purposes and may be published. However, your name will not be on the publications. The information we collect will not be told to anyone, including your doctor or nurse. We will also not tell any medical information to your parents. Your blood samples will be used for research purposes only and be kept indefinitely. When the study is over, we will get rid of your name and any other personal information that could tell us who you are. Giving assent means that you have heard and read the information about the study and that you agree to participate. If you think you have been injured by being in the study, please let the investigator know right away. You can get treatment at Boston Medical Center right away. Taking part in this study is voluntary. You have the right to refuse to take part in the study. If you decide to be in the study and then change your mind, you have the right to stop at any time. By signing this consent form indicates that you have read the consent or have had it read to you, that your questions have been answered to your satisfaction, and that you voluntarily agree to participate in this research study and authorize the use and release of your protected health information. You will receive a copy of this signed consent form.